Good afternoon, everyone. Hope you've had a great day at work today. So just a quick reminder, if you're planning to book for the Emedica National GP Trainee Conference on the 7th September in Birmingham, the early bird discount ends tonight at midnight. So if you book before then, you'll be able to save yourself £100, okay? For those that haven't booked, just to let you know what we're going to cover. So first of all, there'll be keynote lectures that you can all attend. So we'll be looking at the future of general practice, key changes that might affect you during training and afterwards. Dr. Nigar Arif will be talking about portfolio GP careers, how she developed a specialist interest in women's health, how she became a media GP working with the BBC, how she got involved in medical education and her clinical work as both a private GP and an NHS GP. We're going to be looking at trainee money matters, how you can increase your take-home pay without working extra locum sessions, well-being, ways to reduce your stress and look after yourself, your physical and mental health during training and beyond. And then most importantly, we've got 6 different 75-minute interactive workshops. So you'll be able to pick 2 out of the 3 morning workshops, 2 out of 3 afternoon workshops. So in the morning, your choices are dermatology. So Dr. Avad Mughal, consultant dermatologist, is going to be looking at key skills and conditions for GPs. You know, about 10 to 15% of everything you see in GP will have a skin condition related to it. So learning how to take a good history, how to examine, what are the things to watch out for, and then current guidelines for management will help you both in everyday practice, but also because there'll be a lot of questions to do with dermatology in both AKT and CSA. Dr. Nigar Arif will be doing a women's health session, looking at what to ask, what to do, what not to miss for important women's health conditions. Again, there'll be a lot of interactive case studies built in, so it'll help you think about how to approach different scenarios you might see in practice, but also for AKT or CSA. I will be running in the morning an MRCGP AKT Masterclass, what to expect, how to prepare so you can pass first time with flying colours. In the afternoon, your choices are Psychiatry for GPs with Dr. Daniel Jackson. So if you don't have a psych rotation, but you want to look at how to take a good mental health history, when to admit, when to refer, when to use crisis team, what are the important conditions that you need to know how to deal with in GP and how to approach them. That's for you. And then Mr. Imran Khan will be running Ophthalmology for GPs. So, how to manage important conditions, how to manage the red eye, how to manage visual loss, whether it's sudden onset or gradual. And also there'll be demonstrations so that you can practically examine the eye, but also how to do fundoscopy in the GP setting effectively. So that hopefully when you write NAD in the notes, it means nil abnormal detected rather than nothing actually done when you pretend that you're looking at the patient's fundus and actually hope that no one notices, okay? And then I'll be running in the afternoon MRCGP CSA Masterclass. So, why do people fail this challenging exam? How to prepare so you pass first time and smash that exam. So, you'll be able to choose 4 out of the 6 workshops. You tailor it to your learning needs, all right? Those of you that have already booked, we've sent you an email, so do select your workshop so we can allocate you to the right room. Those that haven't booked, I do hope to see you there. If you book before midnight tonight, remember you can save £100, but if not, you can book any time up until the last ticket goes. Over 70% of tickets have already been sold though, so I do hope to see you there. Thank you very much. Any questions about the conference, drop a message in the comments below and I'll try to answer them later today. Thank you very much and I hope to see you there. Thank you.